Alaikum, dear viewers, welcome to my new lecture about the drug acting on autonomic nervous systems. As I have already discussed about the autonomic nervous system, what is sympathetic nervous system, parasympathetic nervous system. So you can see my previous lectures, I have already explained each and everything in detail. But in this lecture, I will just highlight those drugs which belong to particular categories and their doses. Okay, so the drug acting on the autonomic nervous system. So look at here, that is cholinergic drugs. Cholinergic drugs, that is cholinomimetic and parasympathomimetics. Further, the parasympathomimetic drug is divided into two groups. The first one is cholinergic agonist and the second one is anticholinestrases. Further, the cholinergic agonist is divided into two groups. One is choline esters and the second one is alkaloids, while the anticholinestrases is further classified into two categories. One is reversible anticholinestrase, the second one is irreversibles. So there are two types of different enzymes, you can say anticholinestrases, and with these drugs can act upon it. Okay, so the cholinergic agonist, one is choline ester. So choline esters include acetylcholine, methacholine and carbachol and beta-nicols, while the alkaloids include muscarine, pelocarpine and ericolines. While the second one is anticholinestrases, which one is reversible, the second one is irreversible, which I have already explained in my previous lectures. But here I am going to highlight that particular drug and their doses. Reversibles are carbamates and acridine. So carbamates include physostigmines, iserine and neostigmine and pyridostigmines, edorphoniums, rivostic means and donepezils, galantamines. While the acridine include tecrines. The irreversible anticholinestrases, these are carbamates and organophosphates. So carbamates, the irreversible carbamates include carbaryls, so which is available in the market by trade name Siemens. The second one is propoxols, so that is available in a market by trade name Bigons. The second one is organophosphates, which include diplose DFE, which can be represented by symbolics by the capital symbols DFE. The second one is ecothiopates, melathiones and diazonones, TK20 and tavonserines and so on. So these are actually the cholinergic drugs which are cholinomimetic and parasympathomimetics, which I have. This is very simple and very easy to understand. Okay, now come to all the doses. These are the drugs which acting on the autonomic nervous systems. Actually, the nervous system one is sympathetic and the second one is parasympathetic nervous systems, and then peripheral, autonomic and many more. So now come toward the preparations. As we have already discussed, beta-nicols. So beta-nicols, you can see here, this is choline esters which belong to the cholinergic agonist. Now let's see here, there are different doses, so you can memorize all these doses. These are the preparation. So beta-nicol, it is available in 10 to 40 milligram. It can be taken orally. as well as the beta-nicole is available at the dose of 2.5 to 5 milligram, which can be administered subcutaneously. Urotonins and beta-cols, 25 milligram tablets. So they are also available in tablet form. Beta-col, these are the brand names. These are the market name, trade name, through which this drug can purchase. So they are also available in tablet form. The second one is Pelocarpine. So Pelocarpine is available topically in eye. So it can be applied. It is available in 0.5 to 4% topically in eye. Mean you can administer this drug by topically in eye and the cavities. Okay. So the Pelocarpine, that is also means available by different name, Phyllocar, that is 1%, 2%, 4% eye drops, and Carpine is 0.5% eye drops. Pelodrops, so this is also the brand names, which is available in 2% eye drops, so it can be administered directly in the cavities, you can say, by ophthalmic route. Okay, the third one is Physostigmine. So this is another drug which is used. Okay, so Physostigmine is available at the dose of 0.5 to 1.0 milligram oral and IN. Mean this drug is available orally as well as intramuscularly. So this drug is Physostigmine is also available at a dose 0.25, 0.25 and 0.5%. So it can be applied topically in the eye. By myotics, so there is 0.25% eye drops with 2% Pelocarpine nitrate. Another agent that is called Neostigmine. So Neostigmine is available at the dose of 15 to 30 milligram oral. You can see here, Neostigmine is available and 15 to 30 milligram. It can be recommended through oral route. The second one is 0.5 to 2.5 milligram. It can be administered to the patient by subcutaneous route or intravenous route. So these are the different categories. So that is prostigmines and mysostigmines and telostigmine. So that is 15 milligram tablet. Mean they are also available in 15 milligram, 30 milligrams in tablet form, and then 0.5 milligram for ml and 1 ml and then 5 ml injections. It mean it can be given to the patients and oral dosage form as well as in the form of injections. The fifth one is Rivostic So Rivostic that is available in 60 to 180 milligram oral, while the this is you can say the Rivostic that is destinones and mystine, which is also available orally at the dose of 60 milligram. The sixth one is Rivostic Mean. This is another agents which is doing the treatment of, which can apply in the drugs acting on the autonomic nervous system. So initially the Rivostic Mean can be given at the dose of 1.5 milligram BD twice a day, and then increase every 2 weeks by 1.5 milligram per day up to 6 milligram BD. So that is okay. So now let's see here, these are the different doses here, so which are also available in the form of capsule. So Axilons and Rivomir, so that is available in 1.5, 3 milligram per 0.5 and 6.0 milligram capsules. The seventh one is Donepezil. Donepezil is available at the dose of 5 milligram at bed time once daily. So maximum dose is 10 milligram per day. So Donepezil is also available in Donis by the name of Donicept, and Dopezil and Dorent 5-10 milligram tablet. It means this drug is also available in tablet form, but the maximum dose of Donepezil is 10 milligram per day. Another agent is galantamine. So galantamine, they are available at the dose of 4 milligram BD twice a day, but the maximum dose is 12 milligram BD twice a day. It shouldn't be increased from this concentration. So this is the amount, this is the maximum dose. Do not exceed. Okay. There are different type of agents, like, so there are other available brands, that is Calamid, so that is also available in 4 milligram, 8 milligram, 12 milligram tablets. So actually these are the preparations which are available in different doses, so you will have to memorize all these doses by fingertips. So inshallah you will see other lectures of anticholinergic drugs. Inshallah I will explain